Thank you, Helene. And first, I want to thank the organization organizer to have this symposium, especially happened in Harvard. Firstly, I want to thank Dr. Lu and give a very wonderful case. The integration of the acupuncture with conventional medicine for the cancer patients. The purpose of it, we think that the medicine is how to help the patients recover effectively. From Mr. Smith's the presentation, I calculate in the 10 minutes presentation, you just drink one time, right? So you can find that the effectiveness from the patients is how good it is. So the patient's recovery is a source of doctor's happiness. So it's a wonderful case that happened here for integration from Chinese medicine and conventional medicines. The last point is for Dr. Margaret. The doctors always give lots of help, lots of the efforts for the patients, but probably need to pay attention to the healthy ourselves. Today, my topic is about the characteristics and the challenges of clinical trial with Chinese medicines. We give one example of our studies. This morning, we're talking some of the key factors which is probably affecting how we conducted the clinical trial with Chinese medicines. The first one we think is quite important is about the pattern. Professor Yu this morning giving a very detailed explanation about what's the patterns. Patterns is different with disease diagnosis. It's a kind of the summary of the cause, nature, and the location of pathophysiology changes at a certain stage of the disease. It's a different type of diagnosis systems. So in the those are the factors probably is very important for the prescription of the treatment. In the clinical trials, when we're talking about the disease diagnosis for the selection criteria, for the exclusion criteria, most likely we need to combine the pattern into the patient selections. So it's one factor we need to consider, which is quite different from the conventional medicines. Second one is about the interventions. The traditional interventions is probably easier to consider, like the radiotherapy, like the chemotherapies. But in Chinese medicines, most common type for the intervention involving the acupuncture, like Dr. Lu just mentioned for the cancer patients. Secondly, we can see those of the moxibustion, which is very complicated. The third one is about the herbal medicines, which is the most major part in the Chinese medicines. And another one probably have the therapeutic massage phototherapies, which is a major type of the interventions we normally use in the Chinese medicines. When we're talking about the therapeutics for interventions, normally we not just use one type of the interventions. Normally it's a holistically, it's a complex interventions. Probably you have acupuncture and also give some food therapy suggestions to the patients, and also they have some of the Qigong, Tai Chi, or conventional medicines. Those of types is a very common approaches, use holistic approaches. Another one is probably we need to consider is for integration, like Dr. Lo mentioned with acupuncture with radiotherapy. Or in those of the combination is very common type for the practice. For another one we need to consider is how to standardize the research protocols. In the clinical researches, clinical practice, we consider how to individualize the treatment for the individual patients. We always say different patients have the different situation. Therefore, the therapeutic approaches for individual patients normally varied from patient to patient. From this point of view, how to standardize those of the implementation. This is quite important and also is quite a difficulty for conducting randomized controlled trial for the Chinese medicines. That's one important issue, how to make all those of the participants in the trial to have consistently and the same interventions for the whole trials. Another part is for the quality control. We try to have those of the same terms of interventions in the whole studies. We mean the quality control, we make sure to all participants to have the same interventions, and also for the same participants from starting to the end have the same quality of interventions. But it's not very easy to have the quality control for the Chinese medicines. Like we're talking about the Chinese medicine titled herbal medicines. From the single herb to the formulation is quite different to make sure each patient to have the same quality and the same quantities. Other factors including for the placebo design. Normally, when we conduct the randomized control trial, normally we have those placebo controls. Ted, the next speaker, we are talking about how to conduct placebo in the trial designs, which is quite important, like the acupuncture, how we can make sure to have a sham acupuncture in the studies. Another one for how to make sure to have the placebo Chinese herbal medicines, especially for the mixture. Herbal medicine, we try to have some same testing, same color, and the physical identity, which is quite different. So most of the times, we're also talking about probably for placebo design for Chinese medicine, not just a science, it's kinds of, it's arts, or the balance between science and the arts. The final report is about the reporting guidelines. The Chinese medicine, we have more than 2,500 years, but we don't have the standardized reporting guidelines. When we're looking for the literature, probably some cases just have the one sentence, probably have the one book for one case. So how to have a standardized reporting, the standards for the Chinese herbal medicine, which is our effort. So we have some of international groups working together for those of the factors. These kind of factors, not just for, we think, majorly we need to consider when we conduct the clinical trials. For the clinical trial with the Chinese medicines, we want to try very brief landscaping about that. The trial, when we're talking about randomized control trial, the trial, in fact, is very long time ago. We call the Shenlong testing the hundreds of herbs in one day. That's the source of the trials coming from. For the control, which is coming from the 1,061 years, that time they have comparing two drugs. One is the ginseng, another one is the huangqi, to testing which one have the tonified the qi effects. So let's say two patients testing the ginseng and to see which one can run longer, which is the control coming from. But from the history, the first randomized control trials is not coming from China. You can see that first reported trial is coming from England, which is in 1948. But this trial is not the one, the first reported one. First reported trial is coming from 1948. It's published in the BMJ. For the Chinese medicine, when we're talking about the first randomized control trial, is published in 1983, which is conducted in the cardiovascular disease to testing one kind of drugs to see whether they can help those of the patients. But currently, more than 10,000 of the clinical trials in Chinese herbal medicine has been published since the first trial published in 1983. But most of the qualities of reporting is not satisfied. Most of the problems such as a small sample size, lack of scientific background, and lack of the authentication and the quality control, especially lack of the sufficient details of how the readers can repeat of those trials. That's a key problems currently have in the clinical trial with the Chinese medicines. When we consider how to conduct the clinical trials, probably the two major issues we need to follow. The first one, how to combine the characteristics of traditional Chinese medicine and the requirements about the evidence-based approaches of assessment. So that's a major issues we need to consider, like the clinical needs for the traditional Chinese medicine. For the probably lots of the clinical conditions don't need the help from the traditional Chinese medicine, then we don't have the basis to conduct such of trials. Another one is characteristic of Chinese medicine. Just we mentioned the 6 points, but majorly we have the pattern and the interventions. The third point is about the study designs for preparations, implementations, and reportings. Those are the 4 major points for how we can implement the clinical trial combined with the key characteristics with the Chinese medicines. Here we present one case for the functional constipation with the Chinese herbal medicine as a case to see whether the Chinese medicine characteristic could be combined with the requirement for randomized control trials. We are selecting the constipation as a kind of the condition we target on. One major problem is untrained background is the GI for very long time. So we selected the GI disease for constipation, which is very common GI problems. And also, we don't have very successful therapeutic effects from the conventional medicines. So that's the reason we focus on this topic. Firstly, we conduct a systematic review to see whether the Chinese medicine can have effects for functional constipation. Those are the results found that although there are many Chinese herbal medicine intervention has been used, but those of results from the studies the quality is not very, very convincing. Secondly, we're selecting which type of the Chinese formulation could be studied. The first one, we conducted a review for all the Chinese herbal medicine for functional constipation. At last, we found that the MZRW one, which is a very common study, has been used for functional constipation. So therefore, we're selecting this of the MZRW one, which is very commonly used, the 6 herbs of the formulations. This formulation has a very long history, has been used since the Han Dynasty for the constipation. They have many of the functions like moisten the intestine, which is in Chinese medicine terms. It's not easy to understand from the biomedical perspectives. But we're selecting this formulation for study to see whether this formulation really have the effect for functional constipation. So we designed a study based on this rationale. First one is what's the optimal dosage for functional constipation. For the drugs, the dosage is a key factor to decide the effects. Secondly, most of the argue related with the Chinese medicine is the effects normally or probably coming from the placebo effect. So we study whether the MZRW one is a kind of a placebo. The placebo effect sometimes is very good. Sometimes, especially in the clinical trial, we try to avoid those of the placebo effects. The third one, if those of the combination is really effective for the patients, we really want to know pharmacodynamic parameters for MZRW in the human samples. And so based on those of the consideration, we designed the 3 studies. The phase 1 study is through dosage determination study. Secondly, we designed a placebo-controlled study. The third one, we designed the healthy subject studies. So from the study, we found that the first study we conducted for the optimal dose, we selecting the pharmacopoeia recommended dose as a middle dose. And then we give a higher dose and also give a low dose. So it's recommended from the pharmacopoeia as a middle one. Finally, we found a dosage for that studies. In that study, we're selecting the 3 groups of participants to give the different dose, each dose including those of 96 subjects. The results show that the higher dose, means 7.5 BIG a day, is the optimal dose for the functional constipation. And then we conducted with a placebo. We found its MZRW is really safe, and it's better than the placebo. As a Chinese medicine practitioner, we know the Chinese medicine is not just a placebo. It really have the effects. So we conduct another study to see whether they have some of the study, have some effects comparing with currently first-line drugs. This is another study for the healthy subjects. In this of the active control study, we have some of conducted multiple center double-blind double-dummy studies. In this study, we have 2 weeks ranging the patients to see whether those of the potential participants are eligible participants in our studies. And then we go through the 8 weeks of treatment. In this of treatment, we have the real MZRW, real drugs, and also we're selecting a first-line drug currently used in Hong Kong for the public hospital for constipation with the Senokot. And also we have the double placebos for the 8 weeks. And also we have 8 weeks follow-up. In this study, we're selecting for 291 functional constipation. Also, we're not just focused on the disease, we're also selecting the syndrome, the excessive syndrome. So we combine the concept from Western medicine, also from the Chinese medicine, for the patient's selection criteria. This is study period. We're conducting the clinical trial registrations. In this study, we have, this is 1 week the course of the package. For this is a MZRW, this is the placebo. We are looking like quite similar. Basically, when we design the placebo for the Chinese herbal medicine, we hope that we can have physically, which is identical to a real drug. But pharmacologically, we need to in it. They don't have the effects for the patients. So it's really challenging for us to design a real placebo of the herbal mixture for the patients. And then this is the packaging for the Senokot. Senokot to the placebo is not difficult because if the component is quite identical. So this is our packaging for the real herb and the real placebos. In this study, we're also conducting those of the quality for authentications. Not much of the herbs inside, just 6 types. But tell the truth, it's not easy to finding 6 herbs 100% meet the standard from Chinese pharmacopoeia from the market. we spend a long times to collecting all those of herbals and make sure all the patients have the same batch of the herbs. And also, we are selecting a drug company which have the GMP standards to help us to produce those ones. And also, we conduct the quality surveillance for Chinese pharmacopoeia standards, and also we identify those of active ingredients inside. Not just, we still conduct those of the safety surveillance, including microbiome limit testing, the heavy metal testing, pesticide testing, and accelerated stability testing. Because important is because the study normally lasting for 2 years, 1 or 2 years. Probably initial stage, the quality is quite good. But if the study lasts for a long time, in the late stage, those of drugs quality may not meeting the standards. So that's the reason why we conduct the stability studies. We also have those of acute toxicity testing to see whether these drugs are really safe for the patient, although we have those of accumulation literature to support its accuracies. We're also conducting those of the pharmacodynamic assessment. Based on those of the data to supporting the quality of herbs we use for the patients, we can ensure those of the patients, for different patients, can have same quality and quantity of the interventions. For outcome selections, we're selecting the primary outcome is a responder. We claim those of the mean increment for the complete spontaneous bowel movement, which is recommended from the International Roma 3 criteria, used as as a primary outcome. And second outcome also including those of response rate in the follow-up period and chronic transit. Normally, the Chinese medicine outcome assessment, we have patients feedback from, but don't have very objective index for assessment. In this study, we combine subjective and objective outcomes together to see whether those of the herbs can really help the patients. And also we have the individual and the global symptom assessment, and SF36 and adverse events is another outcomes, which is a flow diagram for our whole studies. And in this study, we found that the MZRW versus Senokot, which we found for complete spontaneous bowel movement, which is during the treatment period, the MZRW is really comparable with Senokot. But interestingly, in the follow-up period, you can find MZRW still have very significant effect during the follow-up period. That means when we stop the drugs, the MZRW still can have the effects. Currently, we're still working on that. Why the patients, when they stop taking the drugs, they still have the effects. Normally, explanation, previously we say because of the Chinese medicine changing the nature, changing the characteristic, changing the pattern of the patients. But we want to know more. What's the biomedical mechanism behind? So currently we're working on that part. What's the real mechanism for that one? Another part for the responder rate, we can find that consistently with a complete spontaneous bowel movement, responder rate is really MZRW versus Senokot in the treatment period is quite comparable, but in the follow-up period is quite different. Also, we are testing the chronic transit to see whether the MZRW has an effect comparable with the Senokot. We can find the MZRW is really, which is the MZRW, which is Senokot. We can find they have the big difference. So from this of the studies, we have some major evidence found that MZRW is really have comparable effect to the Senokot during the treatment, and also superior to the Senokot and placebo in the follow-up period. Interestingly, this study is the first study to testing whether the Senokot has the very effective. Although the Senokot has been used in the first-line drugs in the hospital authority, the public hospitals, for very long times, we cannot find one randomized control trial to testing those effects. And also we can find that MZRW has benefits for increasing the complete spontaneous bowel movement and improved the chronic transit and relieving the severity of those of the symptoms, which is patient has a well tolerance and no really serious side effects. So that's major findings from our 4 studies. From this study, we also found that the MZRW could be a kind of the alternative remedy for functional constipation. So probably in the next step, we can consider whether MZRW can take the place of the Senokot in the clinical practice. We're still thinking about whether in the future we can combine the findings from the clinical trials into the clinical practice guideline to let the practitioner to know, let the physicians to know MZRW is really good, especially it's comparable with the Senokot in the treatment period, and it's better in the follow-up period. So that's our future development. Also, we still working on what's the mechanism inside. From these approaches, we think from the systematic review to finding those of the clinical questions to see what's the major problems, what's the major opportunities for Chinese medicines. Secondly, we need to find those of the dose. When we're talking about the interventions, most important factor, the firstly is the dosage. So the dose determination in the clinical trial is really crucial in facting. Secondly, for the placebo, we need to conduct whether those effects coming from the placebo effect. And third one, as a medicine, not just rely on those of the placebos. We need to compare them with the active controls to see whether they are actively comparable with the first-line treatment. Those of the studies we need to consider for high quality, we need to consider the characteristic of Chinese medicine, strict follow-up the requirement of ICTs, and sufficient preparation during the whole stages, and rigorous implementation, and also we need to have the transparent reportings. A few days ago, they have one of the big action in the top 4 medical journals, including the New England Journal of Medicine. We're talking about how to making those of data sharing in the whole clinical trials. We need to sharing those of clinical trial data in the future to make sure to maximize those of knowledge and to protecting those of trial in the patients. So that's be very importantly, probably in the future we need to consider. How to do that one? The Chinese medicine is currently seems to be more popular. We are just talking about Professor Lu's work in the Dana-Farber's Cancer Center, how we can integrate the traditional wisdom in the currently medical systems. I think today's activities, today's forum is a very good example for exchanging between 2 sides, Eastern and Western. Change the idea, changing how to collaboration. So change-based collaboration probably for the good health, not just for patients, in fact, is for ourselves. So This is our acknowledgement for our teams, for collaborators from Chinese University of Hong Kong, from the Chinese Academy of Chinese Medical Science, and also for the funding agencies. That's all my presentation. Thank you.